Thank you for visiting the Hamilton Vein Center. Nearly 80 million people in America suffer from vein problems. Whether you are seeking treatment for large varicose veins, leg swelling or discomfort, or simply do not like the way your legs look, Dr. Hamilton and his staff are highly trained at the diagnosis and treatment of venous disease.
Vein problems are really common. About half of people over the age of 50 have some type of vein issue, either spider veins or varicose veins. Sometimes these will show up as bulging veins. Other times people may just have darkening of the skin around the ankles. They may have heaviness, discomfort, tiredness in the legs. And these are all signs that there can be more serious vein issues underlying that can really be a medical issue for people.
I work as a chef, and part of my problem is that I work on a hard surface. So over years, say about over 30 years, I started developing veins on the legs, and I was developing swelling of the ankles and of the knees. And so I decided it was time to have something done.
Before I had the procedure done, my legs ached all the time, to the point where I would wake up several times during the night because they hurt. They just hurt, and they would wake me up constantly.
I definitely felt a heaviness in my legs every night that I was kind of chalking up to the fact that I'm getting older. It definitely affected my quality of life. At 39, I was tired. I just was tired all the time. My legs, just by nighttime, I was done.
The job of the veins is to take used up or deoxygenated blood from the legs back up to the heart. In order to do this, there's two kinds of veins. There are deep veins, which are deep in the leg and surrounded by muscle. Those veins have the benefit of the muscles to help pump blood back up to the heart. There's also a system of veins called the superficial venous system, and those veins are closer to the skin, and they rely on one-way valves to keep blood flowing up against gravity. What can happen is in people who are prone to it because of family history, people who stand for long periods of time, or women who've been pregnant, is that the veins can stretch out and then the valves don't close. So blood can flow backwards, causing the blood to pool in the legs. This can cause symptoms of leg heaviness, aching, cramping, leg fatigue, and even restless leg syndrome.
Dr. Hamilton is a board-certified vascular and interventional radiologist who specializes in venous disorders. His vast training in diagnostic ultrasound and his skills in performing minimally invasive procedures make him one of the premier vein specialists in the greater Houston area. Dr. Hamilton and his staff strive to deliver the best minimally invasive vein treatments in a friendly, comfortable environment.
Well, the staff here is great. They're very friendly people. If you have any type of question, they will answer it very honestly for you. They're very professional in their mannerisms. Dr. Hamilton is wonderful, very well educated. He'll explain to you what your problem is, and he'll work on your problem.
My experience here at the Hamilton Vein Center, especially with the staff, has been phenomenal. They are loving and caring and just the greatest group of people. Can't say enough nice things about them.
And then just to know you're in really good hands here. They take care of you, explain things, you're treated with respect, which sometimes that's hard to find.
At the time of your initial consultation, Dr. Hamilton or his physician assistant will perform a detailed history and physical exam and may perform a brief screening ultrasound. Based on their assessment, they may recommend a more thorough ultrasound to further evaluate the veins in your legs. The results of your exam and ultrasound will help to guide treatment planning.
The best treatment for varicose veins now is to close these veins from the inside. A while back it used to be vein stripping, which was taking the veins out of the leg, but we don't do that anymore. And now we have much better treatment, and so we heat the vein on the inside of the leg. And the vein that we're closing is one that's not working right. The blood's going the wrong way in that vein. And so by closing that vein, it reroutes the blood into the healthier veins, and it really improves the circulation in the leg. The best treatment for varicose veins really depends on the underlying problem. And so part of our evaluation and workup and ultrasound is really to find the vein that is responsible for the other varicose veins, because usually there's one large vein that's not working right that's supplying the other varicose veins. And so once we identify that abnormal vein where the blood's going backwards in it, then we will close that vein from the inside, usually by heating it on the inside. And what that'll do is it'll close down the source of all the abnormal veins, and it'll allow the blood to get rerouted into the healthier veins, which are better at taking the blood back to the heart, and then it improves the circulation in the legs. And the great thing about the newer treatments that we do for this, there's no downtime after the procedure. People are back to their normal activities the next day or the very same day. And so it works very well and people are very happy with it.
If there's no abnormal blood flow on your ultrasound, you may just need cosmetic treatment for spider veins. This involves injecting a solution called polydocanol into the spider veins with a tiny needle. The solution causes the inside of the walls of the veins to be irritated and scar down. Then the body reabsorbs the veins over time. This may take several sessions, scheduled about a month apart.
We are glad that you have chosen the Hamilton Vein Center. If you have additional questions, we will be happy to answer these at the time of your consultation or at any time during your visit. We hope that you will find that here, you are not just a patient, you are our welcomed guest.